Welcome to Mock Interview Pro, where we help you ace your next job interview. Today, we're focusing on the role of a prior authorization specialist. Whether you're preparing for your first interview or looking to brush up on your skills, we've got you covered. Let's dive into the first question to get you started on the right foot. Can you tell me about a time when a lack of attention to detail impacted your work? How did you fix the mistake? This question aims to understand how you handle errors and learn from them. Employers want to see that you can recognize a mistake and take steps to prevent it in the future. Here are some tips to answer effectively. Pick a specific incident from your past. Clearly describe the error and how it affected your work. Explain the steps you took to correct the situation. Share what the experience taught you. Conclude by discussing how it improved your attention to detail moving forward. Now, let's look at an example answer to bring these tips to life.
In a previous job, I accidentally entered incorrect patient details into our system, which delayed the authorization process. Once I realized the mistake, I reviewed the records, corrected the information, and informed the team. This taught me the importance of double-checking all data entries, and since then, I've adopted a more thorough review process.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for prior authorization specialists. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Describe a situation where you successfully worked as part of a team on a challenging prior authorization case. The goal here is to evaluate your teamwork skills and how you contribute to group efforts, especially in high-pressure situations. Let's go over some pointers to help you prepare your answer. Focus on a specific challenging case where collaboration was key. Highlight the roles each team member played, including your own. Detail the challenge and how you all worked together to solve it. Describe the successful outcome and your takeaways from the experience. Keep your explanation clear and concise. Here's a sample response to help illustrate these points.
In a complex case at work, our team needed multiple authorizations. I coordinated with the physician to gather necessary documents while our admin team contacted the insurance company. Together, we clarified the patient's needs, expedited the process, and successfully secured the authorization. This experience reinforced the value of clear communication and teamwork.
Can you share an example of a particularly difficult prior authorization request you managed and how you handled it? This question assesses your problem-solving skills and how you handle complex situations, which are crucial for a prior authorization specialist. Here's how you can tackle this question. Select an example that highlights your problem-solving abilities. Clearly explain the complexity of the situation. Outline the steps you took to resolve it, including any collaborations. Emphasize the outcome, especially if it benefited the patient. Reflect on what you learned and how it improved your approach. Let's take a look at an example. Answer to see these strategies in action.
I faced a challenge with a high-cost medication request that was initially denied due to lack of prior treatments. I contacted the healthcare provider for supporting documentation, submitted a detailed appeal, and the authorization was granted. This ensured the patient received their medication on time, and I learned the importance of thorough documentation.
If a patient is upset about a denied prior authorization, how would you handle the situation? This question gauges your communication skills and ability to manage sensitive situations with empathy and professionalism. Here's how you can demonstrate your approach. Stay calm and actively listen to the patient's concerns. Show empathy by acknowledging their feelings. Clearly and respectfully explain the reason for the denial. Offer to help by checking for additional information or alternatives. Follow up with the patient to ensure their needs are addressed. Here's an example of how you might handle this scenario.
I would listen to the patient's concerns without interrupting, empathize with their frustration, and explain the denial reasons clearly. I'd offer to help find solutions or alternatives, ensuring to follow up with them afterwards. This approach reassures patients that their concerns are taken seriously.
Imagine a provider submits a prior authorization request that doesn't meet the necessary criteria. How would you communicate this to them? This scenario tests your ability to professionally communicate and collaborate with healthcare providers to ensure all necessary criteria are met. Here's how you can handle this situation smoothly. Acknowledge and thank the provider for their submission. Clearly state the criteria that were not met. Use simple and professional language to avoid confusion. Offer suggestions on how they can revise the request. Provide assistance or resources if needed. Let's look at a sample response to see these tips in action.
Thank you for your prior authorization request. However, it doesn't meet the criteria due to missing supporting documentation. Please include more details on the patient's medical history. I'm here to assist if you have any questions about the requirements.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.